Hey gang, Patrick here. Wanted to share what I believe is some good information from Lothar Weiler, head of the Robert Koch Institute in Germany, that was conveyed during a press conference this morning, March 11th, 2020. So the Robert Koch Institute is basically the equivalent of the CDC in Germany, and Germany is basically, one of the leading countries in the EU, and also where my son goes to school. So very interested in finding out information over there, but also interested in finding out information in general regarding the virus and mitigation of the virus, in part because my wife is in that high-risk category. So let's take a listen at Mr. Weiler's comments. I think they're very informative and they're very applicable to the things that need to go on here in the United States to mitigate this virus. So let's take a listen.
Colleagues, I would like to welcome you to this press conference after the video conference that we had yesterday of the European Council. I would like to welcome the German Chancellor, Dr. Angela Merkel, the German Health Minister, Jens Spahn, and Lothar Weiler, the head of the Robert Koch Institute. Madam Chancellor, Minister, ladies and gentlemen, from a scientific point, let me give you a sense of where I would position this epidemic. Since the 6th of January, in the Institute, we have been intensely analyzing this issue with increasing intensity, and therefore I feel we are in a position to give you an assessment of how this disease is spreading. And we know, and Madam Chancellor quite rightly just said, that it is a pandemic virus. This is a virus that will affect 60 to 70% of humanity. But what we don't know is at what speed. But I think that every one of you can imagine that the longer it takes, the better it is. Firstly, because it gives us a chance to develop a vaccine against it. Secondly, it means that we will have better treatments for it as time passes. And another important aspect for gaining time is that the number of people who have to be looked after by the healthcare system is lower, because these are all measures that we have to bear in mind. If you look at the framework conditions, it's important to take a systematic approach here when it comes to the methods of slowing down the spread of the virus. So we have to slow down its spread. A virus of this kind doesn't spread like a wave going through Germany. It will spread in certain regions. You can see this in Europe, if you look at Europe. I'm often asked, why is it the case that so many people have already died in Italy? Why are there only 2 who have died in Germany? What are you Germans doing differently than your Italian colleagues? But the point is that right from the word go, we have very systematically called on our physicians to test suspected cases. Thankfully, we have the ability to offer these tests on a large level in Germany. So that means that we could look at the spread of this epidemic in a very early phase. Now, if you imagine an epidemic like a curve, however steep or flat it is, then there'll be countries in Europe that are further along the curve, further right, and we're further left, but we will be moving up. And the number of cases will be increasing here, and more people will die here. And many will have very severe cases of the virus. So what do we have to do? Well, we didn't just think about that. There are analyses, and we've had exchanges with other countries that are impacted on by the virus more strongly than us or less strongly than us. So we'll be doing this on the level of the health ministers within Europe, but also the national health institutes like the Robert Koch Institute. So we exchange ideas and work on common approaches. You can see on the Robert Koch Institute there are a number of recommendations that we're constantly updating. So these recommendations are ones that we adapt as the situation unfolds in terms of who are contact persons, how we should track how the virus has spread, how we have to deal with people who might have the virus. So these are systematic approaches based on our own analyses and the analyses of our colleagues in other countries, and we exchange these ideas to get a best practice approach. So slowing down the spread of the virus is something that we have been emphasizing for a number of weeks, and that will continue to be the case, depending on how long it will take. It's likely to take months. It might take years to spread through our country. The longer it takes, the better it is. Can't emphasize that enough. And we have a group that we know will have a very serious case of the virus if they are infected. And those that we would say are chronically ill, and the elderly and very elderly are most at risk, and it's about protecting them. How can we protect them? Well, the best way of protecting them is by not exposing them to the risk of infection. And if you think about the fact that certain events can no longer be visited. Obviously, these are events where there are a lot of people, and there's much more chance of getting infected if there are a lot of people in contact. And this is also true for places where older people might be subjected to the virus. And we are working on recommendations as to how to protect this vulnerable group. Another aspect, apart from slowing down the spread of the virus, protecting the vulnerable groups, the next aspect that's important, one that we keep referring to, is the fact that the hospitals need to be prepared. They need to have a level of readiness so that the clientele of the people who are coming to them will be a different group than they normally get. These will be people with severe respiratory diseases and with pneumonia, and they will need special support. Some of them will be in the ICU, some of them will need ventilation. And this is why it's so important that we keep this group as small as possible so that the hospitals have the capability of providing them with the care they need. And this is what we're calling for here, for the community. All of the decision makers, the mayors, the state assemblies, and the hospitals too have to be prepared for the fact that they will have more patients than they have now. This is the very beginning of an epidemic. And they need to set up their strategies, their business plans, etc., so that they have to be able to deal with as many of these patients as possible so that these patients get the health care that they need. Thank you.